Aloha all, and welcome to the monthly caregiver support group of the Caregiver Foundation. We're so pleased to have Jeanette Koijani from the Kokua as our guest speaker, who will speak about palliative care. And we'll just jump right in. I've asked Jeanette to give a little bit of her personal background, and she'll do a slideshow, tell you more about Kokua services, and of course, palliative care. So I'll turn it over to Jeanette.
Well, thank you very much for the invitation to come and talk with you folks. And I hope that you will today not only be inspired about what palliative care is, but also see that we as Kokua are also a resource in the community. And we hope that you can, that we can partner with you, continue to partner with you going forward. So just a little bit about me. I've been the executive director for about 15 years. I came to Hawaii about 27 years ago to get my master's in public health through the East-West Center. And then my husband and I have stayed. It's a wonderful, wonderful place to live. We came from San Francisco. I myself have been involved with serious illness care for over 30 years, beginning in the AIDS crisis when we lived in San Francisco, and many of our friends and colleagues were sick. And how do we as a community take care of people with serious illness? How do we support people? How do we support the loved ones? How do we build a community where people are well cared for? So for me, that vision is also how Kokua approaches this. We see this very much as a team approach. So I'm very happy to be talking with you guys today. And if folks want to introduce themselves in the chat, that's fine. If you have questions as we go along, you can also put them in the chat. Hopefully people can use the chat because I have one participatory question just to, make sure people are still awake. So that's good. And okay, so would you like me to share the slides, Leanne? Okay.
Yes, please.
Okay. So I'm hoping you can see this. Good. So what we're going to talk about today is palliative care. You may or may not know what that is, but hopefully at the end of today, you will have a better idea about what that is and how palliative care can be helping you as a caregiver. So first of all, Kokua, who are we? We are a 501c3. We're a community benefit organization that works statewide. We are not a state agency, but rather we are a membership organization with all sorts of organizations and individuals that are members and therefore support our work. So in addition to organizations like hospices and health plans and hospitals, we also have amazing volunteers who work across the state to help with this vision of improving care for people with serious illness. And we look at the whole continuum of care. So advanced care planning, which includes advanced directives and PULSE, those are the usual trainings that we do. Palliative care, expanding palliative care access, helping people understand what hospice is, which we're going to touch on today, and then also bereavement, because again, we look at the whole continuum of care. How do we help people, but also how do we help the loved ones? So we have three ways that we try to help people. The first one is how do we help people who may be facing serious illness and their loved ones to understand decisions they may need to make as early as possible. We are all about preventing crisis and helping people to get good information and good resources. So we have, for instance, a really well-managed and actively managed website. We also have a YouTube channel. We have all sorts of good materials that are free for download. So our model is not that 3 o'clock in the morning when you need something that there's a firewall, but what we want is for everybody to be able to access the resources that we have there. So we like to go out in the community and do talks. We have a newsletter that you're welcome to join. So we really like to put people at the middle of what we do. We also are very interested in professional networking and training. How do we help people do their job better? And if you sign up for the newsletter, then you can hear about some of the offerings that we have. For instance, at the end of this month, the Kokua meeting, we have monthly meetings there. We're going to be talking about lymphedema, what it is, and how can it be helping, whether the person that you're caring for, the knowledge about how to address lymphedema. And then the final thing we do is looking at the system. Is there policy, or is there legislation that can raise all boats to improve the situation? So we like to think of ourselves as a movement that helps to make advanced care planning and open communication about care and support for people with serious illness and their loved ones, the cultural norm. How do we help with breaking the taboos? And that's what we're about. And we're so glad that we have a chance to talk with you today. So welcome to our palliative care discussion. So the first thing that I'd like you to do is go to the chat room and put in, what is the first word that comes to mind when you hear the word palliative care? Totally fine to say, I've never heard of it before, but I would like you to put down what it is that you think of when you hear palliative care. And again, no shame if you say, I have no idea what it is. So I will wait until at least one person writes something down. End of life care, I've heard of it, but I don't know what it is. Excellent. Thank you, Leanne, for being honest. Comfort care, very good. Okay, so those are all good. It's a good place to start. And I'm gonna go back to the heart, because these are often words that come up when we think of palliative care. So things like comfort, communication, respect, end of life, empowerment, person-centered, spirit, dignity. Hopefully you'll see that today that these are all important parts of palliative care. It's important to say that you are not, that most people misunderstand what palliative care is. Most providers misunderstand what palliative care is. So we are really happy that we can be talking not only to providers, but people like you, patient advocates, to make sure that people understand what palliative care actually is and what the opportunity is to help people with serious illness. So I have to stop sharing, and then I'm going to share again. Okay, good. I wasn't sure that I clicked the right button. So I'm going to show you a short movie that hopefully will work.
You are a bridge. It's true, or at least it's a good analogy. When you're healthy, when the bridge is sound, you can handle anything. Cars, trucks, trains, all the bumps of life, no problem. You are set. But if you're facing a serious health issue, something like kidney disease, lung disease, or cancer, the bridge starts to falter, cracks appear, and pretty soon it's hard to withstand all that traffic that includes your own medical treatment. And that's where palliative care comes in. Palliative care is a specialized form of medical care specifically designed for people with serious illnesses. Its main goal is to improve your quality of life by providing relief from the symptoms, pain, and stress that are an inevitable byproduct of both the disease and the medical intervention. In short, palliative care provides support for your bridge. And when a bridge is in trouble, there is nothing better. Now, palliative care, just like construction, is a team effort. It takes doctors, nurses, social workers, and other specialists, all working together with your physician to realize that extra layer, the layer that can make all the difference. It's a treatment method that makes sense at any stage of life and at any stage of an illness, because it's never too late to lessen the burden. So, next time someone you care about is facing a serious illness, remember this bridge analogy and be sure to consider the enormous potential of palliative care.
Stop. Okay, so hopefully everybody could see and hear that. And I don't know, the black box is impossible to get away. So it's I think one of the problems with Zoom. So the question, so this is hopefully the video helped. So think about palliative care as specialized medical care that helps people with the symptoms and stress of their serious illness. And the goal is all about quality of life, not only for the patient, but also for the family and loved ones. So again, there's a team approach, as you saw in the movie: doctor, nurse, social worker, chaplain, other specialists, who then work together with the patient's other doctors to provide an extra layer of support. So palliative care can happen at any age and any stage in a serious illness. And importantly, it can go alongside of curative treatments or things that are thought to be life prolonging. So for instance, if someone has cancer, they can be getting curative treatments, radiation or chemotherapy, at the same time as the palliative care, which is addressing some of the symptoms that they are feeling or the stress that they feel. And then again, it is based on the need of the patient and not on the prognosis. So some of the messages, so we are trying to get the message out about what is palliative care and how can it help you. So these are some of the messages that we've found that resonate with patients and with loved ones. So of course, you know, being a caregiver support group, I'm really interested which of these messages is of interest to you. We hope that it will help with quality of life. We hope that it will help with the relief of symptoms, pain, stress. We also talk about not only the physical symptoms, but emotional or spiritual distress that people can be facing. So it's important to say that it's not just physical, and actually the physical can definitely impact the mental state of people. So we like to look at the whole person. I mentioned at any age, at the same time as curative treatments. It's important to talk about as well that what palliative care looks at what the treatment options are and align those with what the patient finds important. What are the goals of the patient? What is that the patient says, this matters to me, and let's create what the treatment plan is going to be. There's a team, and then again, this extra layer of support, this walking alongside of the patient and the family to help support. So some people like visuals, so you can see the larger ellipse is what palliative care can do. And then as we approach the end of life, there are other types of care. So it's important to say with palliative care, it could be that that people would get better, that people wouldn't need end of life or hospice care, or the disease could get worse. And then again, emphasizing the quality of life, then the end of life care is what is needed. So I'm not going to show you this video, but I did want to keep the picture included. This is about a woman from Hilo, and she's talking, or the story is about her journey with supportive care, with palliative care in Hawaii. So if you go onto our website, we have about 6, maybe 7 patient stories so that you can hear people with their own voices. And one of those stories is there's another local story, a woman from Maui whose name is Andrea. My colleague Hope interviewed her, where she's talking all about the pain and palliative care services that she and her husband got. So these are some of the phrases that we use that helps you live as well as possible for as long as possible. Palliative care is also the way care should be. And I know that people, once they hear about it, they're like, wait, what? There's a team? You guys are helping with coordination. There's doctors that I can talk to. There's a spiritual component. This is great. A lot of people really like the concept of palliative care. And what we've found with palliative care, and again, this is not only national, but local research and also experience, is we can see that palliative care is really helping to improve how the entire system is taking care of people. So people are better able to manage the physical and emotional symptoms and have this peace of mind that comes when their care is consistent with what matters most to them. Importantly, families and caregivers also feel better supported and are better equipped to help their loved ones because of this team approach. They have people, for instance, to ask questions of, people that they can go to. They should be included in the decision-making as we go forward. We find that the doctors and nurses and other clinicians really like that there is a holistic approach. There's communication with the patient and the family, and that we see a lot less burnout with palliative care when that is brought in to help the patient. And we also see from an overall systems approach that when we're doing the right type of care, we're avoiding unwanted, unnecessary treatments, we're listening to what a patient and the family wants. That's how we have a much stronger healthcare system. So I did include a couple of studies. If you're interested, there's things you can go look up. So for instance, there are some non-randomized studies that will show reduced pain, increased quality of life. Always the patient and family satisfaction is something that we look at and tends to really go up with palliative care. Helps to keep people out of the hospital and reduce hospital and especially ICU length of stay. So again, if you're interested in studies, there's lots of them. I included these because they are seen as really groundbreaking, that people with palliative care have less depression, improved quality of life, and actually a longer survival time. So again, and I think for those of us that have been caregivers, you can imagine when the symptoms are being managed, people are being listened to, pain is managed, there's a team approach, that why wouldn't people be happier? Families are happier, everybody gets some sleep, people feel like they're supported. So we really can actually see excellent the results of palliative care. Palliative care is a relatively new field, but we do have enough research now to be talking about what the benefits are attached to certain, depending on where the patient is. So there are quite a lot of positive impacts about this, including a 93% self-satisfaction rate, which means when you ask families and patients, would you recommend this to other? 93% of people say, yes, I would recommend palliative care to others. So now you're thinking, okay, great. Where is palliative care available? And there probably will be some questions with this later, but feel free. And so think of it that there's 3 places to get palliative care. One is inpatient. So Queens, Kaiser, all 4 of the hospitals connected to Hawaii Pacific Health. So Straub, Kapiolani, Palimomi, and then on Kauai, Wilcox. Castle over in Kailua, Adventist Health Castle, they have a palliative care program, as does Maui Memorial. Outpatient, so an outpatient clinic, there are oncology outpatient clinics connected to Queens and also Straub and Palimomi. Kapiolani has an outpatient pediatric program, and Kaiser is just about to open up outpatient for a variety of diseases, not just cancer. So that's very exciting. They've hired the 2 docs, they're working on the social workers and the nurses, hiring them. So this is really exciting. As a full disclosure, as a Kaiser member, super glad that they've been doing that. And then the other piece, which we really are working to increase more of at the moment, is in-home palliative care. And that is definitely tied to what type of insurance you have, reality of the American healthcare system. So HMSA has a very robust program called supportive care. UHA has concurrent care, and the VA also has concurrent care. So those are the 3 main programs. And what we've seen is that the agencies that provide this home-based palliative care, some of them have other sorts of services that would be helpful. And the only thing I can say is that you should be asking what each of them have. So Navion, which used to be Hospice Hawaii, they have a program. Kupu Care is in Hilo. Bristol has programs. Islands has programs. There are things that are out there and they're on our website that you can go and look at. And as I mentioned, the main coverage is determined by their by the type of insurance you have. So that, and then what we also have on the Kokua website is all sorts of information for you, for patients and families to learn about this. I mentioned there's some videos there. There's frequently asked questions, and then links to help you determine what type of palliative care might be available for you. So I don't see any questions in the chat, so I'm just going to keep going and talk a little bit about what hospice is, because I think it's important to understand that while it's similar, it's actually, there is a difference between hospice and palliative care. So remember, we talked about palliative care, you can be getting curative treatments on top of all of those wraparound services. Well, when you get into hospice care, the same type of care is available, but you cannot be getting any curative treatments. So hospice care, which is really the gold standard kind of Cadillac, or I suppose nowadays we would, there's other types of cars. It's the Tesla of care for people at the end of life. So it's specialized care for people with a life-limiting illness. Always families and caregivers are included. Physical, emotional, social, and spiritual needs are addressed. And as I said, the team approach is really important. And most of that care happens in the patient's home or home-like setting, so that it just depends where the person is living. If they're in a long-term care facility, you can get hospice there. If they're in the home, then that's where hospice comes. So hospice concentrates on managing a patient's pain and other symptoms so they can live as comfortably as possible and make the most of the time that remains. So that is, it's really important to talk about that quality of life is important and available everywhere. And it's important to say that hospice care allows natural death without the unwanted interventions and provides this ongoing excellent support to the person and their loved ones at the end of life. So why is that important? Well, this patient-centered care team has really been shown to give excellent support. And that is the emotional, spiritual, physical support, and then to the patient and the loved ones. And then also after someone dies, the bereavement support for loved ones are there. So one of the things, for instance, that we see with hospice is you can avoid unwanted emergency room visits. It avoids unwanted hospital stays. Hospice also tends to increase people's lifespan, because a lot of things get managed that weren't happening before. And what it does is shifts the focus of what's the matter with me to what matters to me. What's important to me and how can I emphasize those things that are quality of life? So I would, and you as caregivers probably think about this, but it's the question of, if I was facing a serious illness, how would I spend my time? What's important to me? How do we emphasize that? It may be that with palliative care, some people say, well, I want to live as long as possible, or I want to be alive for my grandson's wedding next summer. That's what matters the most. Other people think about quality of life, what matters most to you. So it really gets people thinking about these important questions. Again, there's no right answer, but I think it's really important that we ask people those questions when we focus on what is important to you. Again, some people really want to do everything possible. Other people will choose that the quality over the quantity. And yes, down here in the corner, there is a horse visiting a patient. This was at a hospice house, not here, but somewhere on the continental US, where a patient could visit with her horse. Horse came to visit. She could be rolled outside and visit, which I think is such an amazing picture. So it's really the question too, as we, help our loved ones, what is it that quality really means? So just a couple of facts about hospice, because like palliative care, a lot of people misunderstand what hospice is. So hospice is almost always in the home or the place where the person lived. It's a team approach. And it shouldn't be seen as a last resort, because there are so many things that can be done to control pain, reduce anxiety, offer spiritual and emotional support, thinking about the quality of life for people with terminal illness and their families. There's no religious affiliation. We know that St. Francis, for instance, is associated with the Catholic healthcare systems, but they are not only for Catholics, and they keep care of people from all faiths and also people who have no faiths, as do all of the hospices in our islands. There's a high respect for all sorts of all cultures and points of view. And they really, as I said before, are supporting not only the patient but the family and their feelings. A lot of people think that hospice is just for people with cancer, and that is not the case. There are people with a variety of serious illnesses that can benefit from hospice care. It's also important to say hospice is not expensive. It is a covered benefit in every health plan. Certainly, it's a covered benefit for Medicare. What may not be covered is room and board in a facility, but the hospices all do fundraising in order to cover those. So they all also have foundations that have, funding to help with that. Somebody asked yesterday, if I'm in hospice, do we stop all medications and treatments? No, absolutely not. This is now, though, looking to see what are the treatments that are most important now that are helping with the pain and the symptoms. When my dad was in hospice, they stopped his cholesterol medicine. My dad did not have 3 years left. He did not need to worry about cholesterol anymore. He had heart failure, so we kept up with the heart medicine, but we didn't need the cholesterol medications anymore. So that is done in consultation with the hospice team, who are specialists in that. Also really important, just like palliative care, hospice does not mean that anyone has failed. It's not about failing, and it's also not about giving up. And I hear that a lot from families. Oh, I don't want to call hospice. The person will think that I've given up on them. Can we turn this around and say your quality of life is what's really important? Comfort and dignity for you is what we're talking about. That's what we're trying to emphasize. So this is all about helping people to see that what we really want to emphasize is the quality of life. I mentioned before, hospice actually can make people live longer. It's proven in any number of research studies. And one of my colleagues who runs a hospice on the Big Island, she said, you know, families will come to us, the patient will come to our facility, then all of a sudden everybody got to sleep, people get to ask questions, the immediate issues of taking care of people, managing people's symptoms, all of that has been passed on to the hospice team. And it's not a surprise that people can actually live longer. A couple other facts. Morphine and good pain management is not speeding up death. It is actually improving the quality of life of people. And then really important, hospice is not the same as euthanasia. Euthanasia is illegal. No one does that. It's also not physician-assisted suicide or medical aid in dying. Hospice is not about speeding up the dying process. So it is possible to live well even in the face of serious illness. So be thinking about ways that we can provide comfort, connection, preparation, and guidance at this difficult time. So both palliative and hospice care can help with that. And those services are available on all of the islands. So just as we come to the end, you know this as caregivers, we know that a diagnosis can be really difficult. And what we see over and over again is exploring the treatment options and discussing, finding out what options are available. And we're talking about that today. How do we access palliative care? How do you access hospice? And talking with your providers about what matters most to you. Those thoughtful conversations, you're as naming an agent and thinking about what your wishes are, those are really important. And I hope that everyone has an advanced healthcare directive already. If not, happy to answer questions about that. And then a POLST. POLST can be really important for people with serious illness. The POLST information is on the Kokua website, and I really like this idea. If you're doing a POLST, you could combine that with a palliative care consult. So hopefully you had a chance to visit the Kokua website, because you can find there all sorts of materials about advanced care planning, what's free advanced directives, the free POLST. We also have materials in many languages. And now we have quite a lot of resources to help you understand what palliative care is. So we hope that you will join us at Kokua. You can, feel free, you can put yourself on the mailing list. You can either put your email in the chat and I'll add you in, or if you go to our website, there's a link at the top to get on the website. And what we share with people are resources, meetings that are coming up, all different types of things. As I mentioned before, we have a lot of free resources on the Kokua website. So I hope that you can go there and that you can download that, including the materials in the different languages. Shouting out that we have now, for the first time in quite a number of years, a guide to funeral and mortuary services, because that has been something that nobody has looked at before. I shouldn't say looked at before, looked at for a long time. So we have a volunteer who pulled together that, that resource. So you can find that on our website. And most of the talks that we do are around advanced care planning. You guys are unique because you wanted to talk about palliative care first, but we're happy to talk to churches and temples, any kind of caregiver group, anybody out there where you want to start a conversation. Most of what we do is on Zoom. We're not, but we are starting slowly to go back in person to talk to people. So I've talked a lot about, and this is how you find us. My colleague Hope wasn't able to join us today, but this is her information. So we talked a lot today about palliative care, but I want to stop and see what kind of questions people have, see what other, what things have come up for you as I was going through that information.
So hi, this is Leanne, and
Hi, Leanne.
I'd like to thank Jeanette. What a comprehensive introduction to palliative care. And while our participants are thinking of questions, you can put it in the chat, or if you raise your hand using the reactions button on the bottom of your screen, you can also jump in. So while folks are thinking of questions, I'll start with a few. And to go back to the words. So why palliative care? It's kind of hard to pronounce and it doesn't really say what how you've described it. And then during the slideshow, you also said supportive care, and then one of the insurance's terminology is concurrent care.
Yep.
So why this language?
Good question, Leanne. So first of all, palliative care, to palliate symptoms, it's to ease the symptoms, and that's where it comes from. So like you may hear, oh, somebody had palliative radiation. So that was radiation to palliate the symptoms, or palliate. You can pronounce it in two ways. So that's where it comes from. The field is about 20 years old. I was not there to name it. I'll be honest with you, though, I think that regardless what we call it, people will need some explanation about it, and people are also hesitant. So one of the heroes in our field is a physician named Ira Byock. Wonderful man. Go and read his stuff. It's super inspirational. And I stole from him a couple of years ago. He said, we could call this the rainbow connection, and people would not really want to do it because we are talking about serious illness, serious topics. So while palliative is a new word, most of the time, now you've all learned it, you can do it. I think it has to do with the fact that we're talking about serious illness. I think also, I don't know what you guys think. And I'm interested which of those phrases that we use work with you. Is it the extra layer of support? Is that interesting? Is it walking alongside the patient? Is it, the support for quality of life? Those things are important to say. I'm interested what works for you guys. But the language is not simple. And to be honest with you, we have a palliative care awareness committee. We started about 1.5 years ago because we heard that so many people were confused. Okay, what do we do? Well, we actually decided to start with providers because providers were saying palliative care is the same as hospice care, and I'm never going to talk about hospice care with my patient. It's like, oh, well, that's useful, doc. That's not good. Let's help you to understand what palliative care is. So we started to see how could we reach out to providers, because again, they were very skeptical, and what they're very hesitant to do is to worry their patient. And this happens all the time. Like, oh, okay, I'd like to talk to you about hospice. Then people freak out. They're suing the doctor. They're threatening to walk out, all those kinds of things. So I could see why providers are kind of hesitant to bring up stuff that might worry the family, because back to where we started, communication is really important. So I think that as caregivers, it's really important to become comfortable with the terms, talk to the doctor about it. This is important to me. Quality of life is important to me. When would palliative care be important? How would I get a palliative care consult? All those things are important. So our palliative care committee, we thought, okay, we'll just list on our website all the palliative care that's available. Well, that's back to your good question, Leanne. No, HMSA calls it supportive care, which is a nice name. Good, right? I like supportive care. What do you guys think? Supportive care, right? Concurrent care. Okay, concurrent care. You get one kind of care and you get the other one. Okay. Supportive care we like a lot. It's not a field, though. The field of medicine is called palliative care. You can get board certified in palliative care. You take your exams of palliative care. There is a journal of palliative medicine. So the fact that we don't necessarily like the name is not going to help, right? So palliative care is there to stay. But a bunch of people have chosen different names and also trying to make it as ambiguous as possible, which I don't know that that helps, to be honest with you. So anyway, here we are doing talks about understanding what care is appropriate and available to people, whatever we're calling it, rainbow connection. This is what it can do for us. So you're part of our advanced team of, okay, help us get the word out. It may be awkward to you, but this is really great care that people are not taking advantage of, and they're not accessing it soon. So that's another reason that we're really glad to be talking to caregivers like, hey, this is out there and you can be asking for extra help. So Leanne, very good question. Names, it's confusing, but I am not so powerful that I get to change the name of an entire field of medicine. So there we go.
That's very helpful. So we will learn how to pronounce palliative.
Palliative care.
Yeah, at least to speak to the doctor. So there's a question in the chat, which is very appropriate at this time. At what stage can someone require and request palliative care?
Right. So, another piece that I want you to hear is that it is not that palliative care in Hawaii is totally fabulous, available to all people at all times. We need more advocacy. And I'm really glad that you folks can be part of that, because we need more palliative care. So theoretically, somebody in terms of the definition of palliative care, from the time of serious illness diagnosis, you can ask for palliative care. The reality, it may be that that's not available in the same ways. And you're thinking of what is it that somebody needs. So for instance, if let's take a person with cancer. If somebody has cancer, they've been diagnosed with cancer, probably right away, the mental and emotional stress is huge. How can they get some support to deal with that? Long before they're taking, they're doing chemo or have surgery or any of that. Why has God abandoned me? Who's going to take care of my kids? All those things come up and could be something that a palliative care team can help you with. So that's why I'm also saying, so if we think about it, what are the agencies that provide palliative care? They may be able to help you. But we do not have widespread palliative care for every single type of health insurance. Those types of care, though, are available. So you may be asking for that support without it being called palliative care. So part of what we're also doing is making people aware, wait, the emotional, spiritual support that people need, that needs to be also happening. And I think it's also important to say, so what you're asking for is a palliative care consult. If you're in a hospital, you're asking for a palliative care consult. If you are in an outpatient clinic, you're asking for a palliative care consult. If somebody is home, then you're trying to ask, how do I access palliative care? You could ask for a palliative care consult, see how they respond. If you have HMSA, you can access palliative care services. The VA has lots of different services, and we did 2 webinars about all the services that the VA has to offer. So you can watch those on our YouTube channel. And then I will say, if you have UHA, that type of care can start much earlier. HMSA has a 3-month benefit, which, yes, people run out, then you can try and get exceptions. But my advice is to not wait, but rather to begin, if the stress is happening, if there's a fire that is, all these things going on, then that's when you should be asking for palliative care. So theoretically, it could be from the time of diagnosis. If there are issues that patients are facing where they need that support, but we don't have enough palliative care yet. Hospice is different. So some people like to think of hospice as a type of palliative care. So if that works for you, that's fine. Hospice is actually very widespread, very well developed, and really accessed far too little in Hawaii. People are in hospice in Hawaii for less than 2 weeks. even though there is actually no time limit on hospice. And the advice is that if someone, where the doctor would say you have 6 months or less to live, then you would qualify for hospice. So my advice is to learn about what hospice is. I talked to somebody last week whose mom's at Queens, had a stroke. She's trying to learn about hospice. Like, oh, great. How come you're so, akamai about this? She said, no, my mom went to your talk at Pohainani and she did all this stuff. So we're all like on it. We've done all these things. So what's hospice? How do I find about it? So my advice to her was to go and start, look at the hospices, interview them, see what's available, see when you would qualify. No one that I have ever talked to in the 30 years of being involved with this work ever said, I'm so sorry, I called hospice too early. That's not a thing. Everyone says, why didn't I call earlier? So we're back to languaging. We're back to helping people to see we're not giving up on you. What we're doing is trying to provide this quality of life. So again, hospice is very, very available around the islands. On this island, I live on Oahu. I don't know where everybody's from. There's 5 hospices. They're providing excellent care. So those services are available. So like my friend, I would say, interview them, see what they have to offer. It's always better to be, there's that expression, always better to be 5 years too early than 10 minutes too late. Better to be a month early than 5 minutes too late, that there's been a crisis and now you have to choose immediately what to do. So again, we're all about starting early. And I will say one of the things that I always advise for people with hospice, if someone has a serious illness, if somebody has a diagnosis, be asking questions now to figure out what does it look like when they're going to qualify for hospice. So my dad had congestive heart failure, and they tried some different treatments, but I remember the conversation with the doctor of what would it look like to get my dad into hospice, like what would and it was interesting because she said, oh, he qualifies for hospice now. And I said, well, why are we not talking about it? Oh, I didn't want to worry you. Well, thanks. So that's good. Guess what I do for a living? So then we could talk about that. How do we enroll dad? What would be appropriate? We talked about POLST. I still remember the conversation about POLST because they had 2 doctors in the room. And I said, what about my dad's POLST? One doctor said, nope, Don, you're going to live for 10 years. We don't need that. Walked out. The other woman said, I'm so glad you brought it up. This is really important. We want to send your dad home, but we don't want to do it without a POLST. My dad died within the month. So much for the other guy. But because I was also very scared about my dad going home without a POLST. He was very frail and without those instructions. So again, and where he was staying, they didn't have palliative care, but they did have really good hospice. So anyway, I'll stop. So you can always get me to talk more about this, but I really, how do we get more comfortable with conversations? How do we break the ice? How do we get people talking about it so that we can really be getting good care for people? That's our goal.
Okay, there's another question in the chat, and they also want to ask a side question because this participant is on Maui. So the first question is, if HMSA has a 3-month cap on palliative care, when does the clock start on those 3 months? And then the second question is how prevalent, accepted, available are palliative care services on the neighbor islands.
Right. And again, this is something we really need to work on. We need more of the palliative care across the board. So at the moment, the way palliative care is being offered in the home is through agencies that also provide hospice. So they'll have a separate line of business that's palliative care, but they provide hospice. So you may notice on this island, on Oahu, different from Maui, people have kind of changed their names. So it used to be Hospice Hawaii, and now it's called Navian. So no hospice, no palliative care, nothing. So people are not as afraid of calling them. The neighbor islands, they haven't changed the names yet. So Hospice Maui, excellent palliative care program, and also islands. So again, islands, not Islands Hospice or Islands Palliative Care, but islands. They provide both palliative care and hospice on Maui. And both Hospice Maui and Islands have a home where people can live. They have a hospice facility, and on this island as well. So let me carry on with the neighbor island first, and then I'll come back to the HMSA benefits specifically. So hospice covers all of our islands, which means palliative care is in all of those places. So each of the agencies provides some do lots, like Hilo. There's a huge amount of hospice, of palliative care going on in Hilo. They also have a beautiful hospice facility. If you have loved ones in Hilo, wow, that is just like the top of the line hospice house. But, you know, Kauai, North Hawaii, Kona, everyone, all of the neighbor islands do have through those facilities. On Kauai, Wilcox has some palliative care in the hospital, and also on Maui, Maui Memorial does. And if you learn things, Miley, you could tell me, because you know, we know that things are going on at the hospital. They're talking about more palliative care. They have other issues at the moment. So I know there's a nurse at Maui Memorial. They've been talking about partnering with physicians to also offer support. So that's evolving. But what we really need is for people to say, I want palliative care, so that the community is asking for it. So people see that this is really an issue. In Hilo at the hospital, the Hawaii Care Choices, again, they changed their name so that people didn't worry that it was only hospice. Hawaii Care Choices has just excellent across the board, early palliative care and consult with the hospital, excellent hospice care. So just depends where you are. So, but again, we need more. So the way the HMSA benefit works, and what you should do is talk to your doctor. If your doctor doesn't know about it, send them to the Kokua Mau website and tell them that, hey, Kokua Mau is happy to go out and tell you more about this benefit. We actually have a whole toolkit now for doctors. There's a workflow, there's a clinical triggers, there's a screening tool. We really want doctors to be stepping up to understand that. So you can think of it as 3 months, you can think of it as 90 days. What I hear over and over again is that people weren't able to use the whole 90 days. So talk to the doctor, see how to get in, and to help then the palliative care team will then manage the need for palliative care. What are the different issues? What is the pain, the shortness of breath, emotional support, spiritual support, coordinating with other doctors to do that. But it is only 3 months, and it does run out for some people, but much better to have the 3 months. And the other thing that happens most of the time is that people will shift into hospice care. The vast majority of people, so this is, again, you can help us with this. The vast majority of people that sign up for palliative care are appropriate for hospice, but they're not willing to talk about hospice yet. So they go into palliative care, even though they could be in hospice care. So I would say, rather than wait and say, hey, I want to save the 90 days or whatever, go ahead, get that service, see how that could be managing the symptoms, getting things under control, and then be consulting with the doctor. Like if things get, what people do, for instance, is if the things get under control, they may go off of supportive care, save up some days in case they need it again, or with the doctor, come up with some other alternatives, if that helps you.
Okay, so the hour has zipped by too quickly. I think we're going to have to invite Jeanette back, and I would invite all of our participants to please stay on the Zoom. What we're going to do is conclude the recording, but we can all stay on to talk story more with Jeanette if you can stay on. So thank you all for watching our video, for participating today. Please check out the Kokua Mau website. We will be sending out information to all on our e-newsletter. So mahalo, Jeanette, and thanks to all of our participants.